Greetings, talofa lava, malo i le lei, nisa pulavanaka, whakalofa lahi atu, malo ni, kia orana, kia ora koutou. Greetings, tinara koutou katoa i te iwi o Aotearoa, me whenua moi moi. Ko au te tumuaki a tū Te Akaaka Roa, the New Zealand National Office, ko Mark Lawrence toko ingoa. Greetings to you all. I am Mark Lawrence, the New Zealand Chair of the New Zealand National Office, also referred to as Te Akaaka Roa. I'm an adult psychiatrist working in the Bay of Plenty, and like many of you have been working, adjusting and adapting to the many changes with our new work environment under COVID-19 and the increased use of telehealth. I would like to give you some brief comments from the New Zealand perspective as part of the college's commitment to updating our trainees, affiliates and fellows during the COVID-19 response. Firstly, I want to acknowledge all the hard work achieved during the lockdown period so far. And as New Zealand goes into alert level 3, I do want to applaud your tireless efforts and commitment to the communities that you serve over these challenging times. The various college committees, sections, faculties, the board and of course the college staff continue to provide support and advocacy at these challenging times. Nō reira, ngā mihi tino nui ki a koutou. We are all working differently at this time, and it seems that we are doing pretty well in relation to our public health response and directions from our respective governments. On a world stage, New Zealand and Australia are performing extremely well with significantly lower morbidity and mortality rates. We are doing well, but we need to keep this going. At times, we may feel overburdened by the amount of information that's out there on COVID-19. For New Zealanders, I really want you to ensure that you get the best advice from the Ministry of Health website. It's up-to-date information. To our consumers, our tangata whaiora, who are also struggling at this time, I encourage you to look at the Mental Health Foundation website. Also, Te Ora and Lava are excellent resources for Māori and Pacifica. In terms of updating you from the National Office, we are now meeting monthly and doing this remotely to continue addressing the important issues for our committee. Please remember we are open and we are happy to support our members. Some highlights from our recent meetings include the Medical Council of New Zealand and the CPD requirements. They've extended these, and we don't have to meet the current requirements of the timeframes, so these have been extended. The committee has made some significant contributions to the suicide prevention strategy, and I anticipate our vulnerable populations may become more vulnerable at these times, and we need to watch this space carefully. We are providing opinions on the implementation strategy for the He Ara Oranga inquiry, the mental health inquiry. We are also endorsing climate change statements from the New Zealand Climate and Health Council, Ora Taiao, and also statements from the New Zealand College of Public Health and the Council of Medical Colleges statement on climate change. Some key priorities in our work plan include greater capacity for our future workforce in mental health, increasing the Indigenous workforce and providing more support and intervention in the rural sector in mental health. Please remember that there is a postponement of the New Zealand conference in Napier, which is now for late November 2020 and early December. I hope to see many of you there. The committee does want to acknowledge the enormous strain at this time on our trainees, especially those trainees who are planning to sit examinations in April and July. I am sure that you can all agree that the safety of our trainees is paramount, and I am sure when it is logistically viable and safe, trainees will be informed as soon as possible of the new examination schedules. Please keep studying hard and keep up the great work. Lastly, I want to share 5 tips on getting through these challenging times. Tuatahi first. Kia manawa nui. Be determined. Don't be too overwhelmed. Do the best you can in these challenging times and see this as an opportunity to develop and grow. Tuarua second. Kia haumaru. Be safe. Make sure that you are safe and engage in actions that keep you both physically and emotionally balanced. By doing this, you will keep your own bubble safe too. Tuatoru, third. Kia toa. Be brave. We all need to be brave and anticipate things may become more challenging in the near future. By anticipating more challenging times ahead, we can plan and organise ourselves better. Tuawha, fourth. Kia kaha. Let's be strong. Be strong in our leadership. Lead by example and advocate for actions that support the communities that we serve. If we face challenges, the college is here to tautoko, to support you, so please let us know and contact us. Tuarima, fifth and final tip. He waka eke noa. We are all in this together, so let's work together in our teams and make a difference. Kia ora tātou.